Good evening, ladies and gentlemen, and welcome to yet another interesting topic or session where we'll be talking about something that affects a lot of children worldwide, especially special children. I remain my humble self, Lucky, Dr. Drugs, and tonight I have the pleasure of presenting this amazing topic for us. And it's none other than ADHD, attention deficit hyperactivity disorder, which is often associated with autism. So let's sit back and enjoy this amazing seminar while we get things started. I remain my humble self, Dr. Drugs, and our table of content goes thus. Now, we can't talk about these things without defining them. We have to talk about the types of ADHD, signs and symptoms, causes and risk factors, diagnosis, complications, epidemiology, treatment, all the way down to the importance of natural pharmaceuticals in management of ADHD. Attention deficit hyperactivity disorder is a neurodevelopmental disorder that affects both children and adults. It's characterized by patterns of inattention, for instance, difficulty focusing, hyperactivity, impulsivity, acting without thinking, interrupting others, and of course, or difficulty waiting. Restlessness is not left out, and so on and so forth. It's usually diagnosed in childhood, but can persist into adulthood. Now, let's just recap on ASD, autism, because they actually exist together oftentimes. That's why it's important we have an idea what they are by definition and distinguish them from each other. Now, autism is a developmental disorder of variable severity, significantly affecting verbal and non-verbal communication and social interactions, restricted or repeated pattern of thought and behavior, or simply it's a neurodevelopmental disorder that affects communication, social interaction, and behavior. Believe it or not, it is a silent epidemic, and we have various types of ADHD. Now, there are three main types. Of course, we have the inattentive type, formerly known as ADD. Then we have the hyperactive impulsive type and the combined type. Now, the inattentive type presents with symptoms like difficulty sustaining attention, easily distracted, being disorganized, often forgetful, and so on and so forth. But bear in mind that it's more common in girls and may go unnoticed for longer. Then the hyperactive impulsive presentation involves fidgeting, talking excessively, being loquacious, interrupts others while they're talking, has trouble sitting still, and so on and so forth. Then the combination of both of them gives us what we know as the combined presentation. Now, this is the most common type and includes symptoms of both inattention and hyperactivity. But the diagnosis is made when 6 or more symptoms from both categories are present. And in some cases, in teenagers, 5 is just enough. What are the signs and symptoms? Now, we talked about children being easily distracted, and that is under the section of the inattention symptoms. Now, there are careless mistakes that are being made, and they have trouble staying focused. They don't seem to listen when spoken to and struggle seriously to follow instructions. They avoid tasks that require sustained efforts, like their homework, and they often lose things, as well as forget daily activities, and they have difficulty organizing tasks or activities. That's why if you enter the room of someone that has ADHD, you find out that everywhere may be disorganized. If you look at this animation on the right side, this just gives us an idea of what happens to a hyperactive and impulsive special child that is having ADHD. You see, fidgets or squirms constantly, gets up when expected to stay seated, runs or climbs in inappropriate situations, talks excessively, interrupts others, blots out answers before questions are finished. They have trouble waiting their turn, feel restless and always on edge, always on the go. Then difficulty playing or doing activities quietly. Now, in addition, these symptoms usually appear before the age of 12, and they must be present in more than one setting. That, for instance, school and at home, church and in school, and so on and so forth. And the symptoms must interfere with the daily functioning of the child. Now, there's this animation I love so much called Gumball. And if you want to know what ADHD looks like, just take a look at the bottom right corner of this screen, and you see that this animation depicts classical ADHD and autism symptoms. Okay, so that's just on the lighter note. Now, the exact cause of ADHD isn't fully understood, but research shows that it's likely due to a combination of genetic, neurological, and environmental factors. But let's bear in mind that ADHD is unique in the sense that it's not pathological. We'll talk about that shortly. Now, the genetic aspect, of course, we know that it's probably as a result of the fact that it runs in the family, and of course, several genes that are involved in brain development and neurotransmitters. Please, let's take note of this aspect because we're going to talk about that shortly. The structure and function of the brain is not left out because differences in brain areas responsible for attention, impulse control, and executive function can actually be affected. We'll emphasize more on this soon. Of course, lower activity in the frontal lobe and others. Then we have neurotransmitter imbalance, especially norepinephrine and dopamine. Then the risk factors are family history, premature birth, exposure to toxins, especially during pregnancy. Some women that are exposed to alcohol, tobacco. If you remember when we talked about substances that provoke ASD, we mentioned heavy metals like lead, and you can find them in some cosmetics like lipstick. Then we have brain injury, especially in the frontal lobe area. Maternal stress is not left out, especially substance abuse as well during pregnancy. And then sugar. In fact, sugar is more like it's toxic to children that have ADHD. That's technically. Now, we're talking about maternal stress. It involves the emotional and physical stress. When a woman is not happy when she's pregnant, can also provoke this condition. Can you imagine? Now, let's note that ADHD is not caused by poor parenting, but too much sugar, screen time with wrong materials can actually worsen or provoke it. Okay? Now, how does refined sugar affect ADHD? Remember, we've talked about the gut-brain axis. It can actually lead to imbalance in gut bacteria, cause inflammation, blood sugar fluctuations that can also alter their moods and behaviors. Then, of course, neurotransmitter imbalance is not left out because, sugar can actually affect serotonin and dopamine, especially the emotional center and the reward center of the brain. Then we have hyperactivity because sugar gives excess energy. Of course, we know that already. We talked about that when we're talking about autism. Sleep disturbances are not left out. Increased cravings and nutrient imbalance. So how do we minimize the potential effects of refined sugar on attention deficit hyperactivity disorder? Let's try limiting or avoiding refined sugars. Choose natural sources of sugar like fruits and vegetables. Of course, reading food labels carefully and opting for products with minimal added sugar. Now, focusing on balanced diet, rich in whole, nutrient-dense food, not left out, and so on and so forth. So how do we diagnose this condition? Now, the diagnosis of ADHD is clinical, meaning it's based on behavior and symptoms, and not blood tests or scans. I know a lot of parents focus more on unnecessary tests and scans. Some of them, when they send results, they send their history of their child. You see a lot of tests, a lot of brain scans, a lot of those are just oftentimes just waste of time and money. By just observing a child and certain parameters we'll discuss about, we see how this can easily be noticed. A lot of people have children that have autism. A lot of people have children that have ADHD without even knowing. Now, clinical evaluation is by a health care professional, okay? And he will do this based on detailed history of the child or adult's behavior, because some adults actually have this. Then, of course, reports from multiple sources. There's an African adage that it takes a whole village or community to train a child. Then, of course, observation is not left out, because over time, you need to observe in different settings like home, school, work. And of course, diagnostic criteria like the DCM-5 okay, which is basically the diagnostic and statistical manual for mental disorder that we're talking about the 5th edition here. It tells that at least 6 symptoms must be present, okay? And the symptoms must be present for at least 6 months. They must be inappropriate for the person's developmental level, appear before the age of 12, be seen in 2 or more settings, and interfere in daily functions as aforementioned. And there are other types of assessment that can be used, like interviews, behavior rating scales, school reports, medical and developmental history. And we have to rule out other causes like anxiety, depression, even autism itself, and so on and so forth. Now, there is no single test that confirms ADHD. There's no lab test, brain scan, genetic test that can diagnose ADHD on its own. Now, imaging like MRI may be used to rule out other conditions if necessary. So please, parents, let's stop wasting time. Time is of the essence. And we'll find out why shortly. Now, but in adults, we have certain parameters we look at because adults may struggle with time management, they may be disorganized, impulsive, and so on and so forth. So what are the complications? If we look at this fellow in the screen, you can see how confused this person is looking while doing an assignment. So ADHD can lead to several complications, especially if it's undiagnosed or poorly managed, okay? And this affects personal, social, academic, and work life, okay? Now, academic or work struggles are not left out because poor performance due to inattention or disorganization, incomplete tasks, missed deadlines, difficulty following instructions, and so on and so forth. Then we talk about the social and relationship issues. So people find it very difficult to maintain friendships, and they are often involved in separation and divorce. Yes, actually, ADHD can be responsible for this. Impulsive behavior may lead to conflict, and there's struggles in romantic and or family relationships. There you have it. Now, low self-esteem is not left out, and they are risky or impulsive behavior. Someone that has ADHD can just jump from one-story building ahead of a child in either the US or Canada that jumped from the first floor. God so kind, the child did not die. That's ADHD action. It coexists with autism. So we'll talk about that shortly. And of course, there are higher incidence of accidents or injuries. That's why I always add the somatic stem cell stimulant based cream that contains very powerful antimicrobial agents that we apply on injuries. I always add it, oftentimes for children that are for special children because of things like this. Of course, legal or financial problems, coexisting mental health conditions like anxiety disorder and so on and so forth, learning disability, sleep problems, and so on and so forth. Now, the epidemiology of this condition, it affects so many children worldwide, okay? And of course, the age onset is typically before the age of 12, and it's more common in boys than girls. Same with autism. So there's something I want us to bear in mind, and this is a very sad fact, okay? Higher diagnosis rates in some high-income countries like the US and Canada. We know why. Because they're always taking refined foods, they're always eating unhealthy, advertising unhealthy things people should consume, and so on and so forth. And look at the result. America virtually may be the capital of intellectual disabilities worldwide, and it's as a result of what they are consuming. Okay. Then, of course, there are lower rates in parts of Africa and Asia, possibly due to underdiagnosis and cultural differences or perception of behavior. But let's be realistic, because they are eating more natural foods. That's why. Although, unfortunately, these trends from the Western world are slowly encroaching into this part of the world, Africa and Asia, and you can see that there's a commensurate rise and increase in problems that have to do with intellectual disabilities like autism and ADHD. Of course, it exists with other conditions like depression and all that, and especially learning disabilities and autism. Now, lower academic achievements are not left out, the risky behavior and substance abuse, and so on and so forth. Now, how do we manage or treat ADHD? Good news, ADHD is actually treatable, okay? The goal of treatment is to manage symptoms, improve functioning, neural function, and of course, enhance quality of life. Treatment is usually multimodal. That is, there's no particular or single approach towards it. It's actually all encompassing. As in, we have to approach it with a combination of approaches, okay, to make it more effective. The word cure is not used because it's not as a result of a pathological factor or parameter. Now, the main treatment options include medication. Oftentimes people use stimulants. You can see them here, like Adderall and so on. Non-stimulants, like, of course, clonidine and so on and so forth. Then, of course, behavioral therapy, as well as applied behavioral analysis. We've talked about that recently, of course, and you see that this helps with managing routines, self-control, and organization. And it's especially useful in special children and in combination with other parameters like the use of natural pharmaceuticals and so on and so forth. Now, parent training and support is not left out. Of course, remember I always say that the mother is the first doctor after God. Then we have educational support, counseling, and psychotherapy in some extreme cases, lifestyle and environmental changes, regular sleep, avoiding what you're not supposed to take and take what you're not supposed to avoid, and so on and so forth. And of course, the earlier, the better. But please, let's be aware that all chemical drugs are poison and they have side effects. So in as much as parents are giving children all sorts of things, the Adderall and all that, go and check for the side effects. I'm not saying that you should disobey your health practitioner, but if possible, do all what you can to avoid the use of chemical drugs, in these conditions. We keep talking about improved neural connectivity and neuroplasticity, and we always mention that the earlier, the better. Let's bear in mind that nerve cells grow and recover relatively slowly. Because the brain is adaptable, is malleable, and is changeable. Of course, that means we have to achieve this early, because the earlier the better. Because the older one gets, the slower the brain adapts to changes. And this is how the brain changes. Experience, for example, applied behavioral analysis, and of course, nourishment is not left out. But let's just quickly look at applied behavioral analysis, because it's very, very crucial in ADHD treatment. Applied behavioral analysis is a scientific approach to understanding and changing behavior. It involves the use of techniques based on principles of behavior analysis to increase desired behavior and reduce problem behavior. Now, ABA is often used in treatment of autism spectrum disorder, as well as other developmental disabilities and mental health conditions like ADHD. This is what I call 10 commandments of ABA. We talked about this before. And then, what are the challenges in the management of ADHD? Delayed or missed diagnosis. Symptoms can be mistaken for laziness, defiance, or emotional issues. Girls and adults are often underdiagnosed, especially with inattentive type ADHD. There's stigma and misconception. This is the worst of them all. Because fear of being labeled or judged can prevent people from seeking help. Then, of course, myths like ADHD isn't real, especially those that are ambassadors of Coca-Cola and Fanta and Sprite. It's caused by bad parenting. It's not true. That statement is very wrong. And some people now, sometimes they believe that it's witchcraft. Some will say it's Obanje or something, Emere or something, whereas these things are not true. And these are the things that hinder early intervention and can be barriers. Okay? Now, medications used. You see, these medication issues, the medications that are used, they have issues because finding the right medication and dose can take time, because no two people are the same. No two special children are the same. Okay? Some experience side effects. We mentioned that earlier. And of course, parents may be afraid of dependency or misuse. Bear in mind that many of these chemical drugs are very addictive. And when you withdraw them, they can manifest what is called withdrawal syndrome. That's another problem again. It's like using a masquerade to chase another masquerade, honestly. Sometimes it's like people are stuck between the devil and the deep blue sea, or they're carrying wahala like this child in this picture here, carrying all sorts of problems on his head. Now, limited access to care. You know that there's a country That's one of the highest exporters of health practitioners in the world today. May God help that country. Then the cost of treatment is not left out. You see, handling a special child is like taking a first class seat in an airplane. It's not the same as economy at all. You must spend more. You must dedicate more time and be more committed. There's no cheap way there. You can never have a special child and begin to treat the special child the way you treat the other children. It doesn't work that way. The children are called special for a reason. Of course, then schools may lack proper resources for support, especially in this part of the world, where some teachers will beat the hell out of these children. Some of them collapse, like the other woman on the chat that went to pick her child from the ground because the child couldn't even say what happened. She doesn't even know what happened. They just call her that her child is on the floor in the classroom. She just went there and picked her child up. What a very terrible situation. Who knows what may have happened here. Now, we have coexisting conditions. Of course, ADHD can, it can occur with anxiety, depression, even autism as well. And that this makes treatment more complex, because ADHD is firing up, autism may be piping down, and you need something to satisfy both issues. Usually very difficult, honestly. Now, one condition may even mask or worsen the other. Then we have poor treatment adherence, then behavioral resistance. There are some children that may resist, structure, behavior plans, or therapy. And of course, family and environmental stress is not left out. What is the relationship between autism and ADHD? It's a very powerful question people have been asking and wondering why. How is it possible to have two conditions at the same time and they exist peacefully, in the same special child? ADHD and autism are separate neurodevelopmental disorders that can share some symptoms, okay? And this is how this tells us how we can differentiate them and how they are related with each other. Of course, they share common parameters, and of course, they are distinct from each other. Now, this part is very, very important, okay? If you look at these structures on the right, you find that we're looking at the brain, all right? And you will see that the brain has different sections that help to coordinate and organize different aspects in a child or in humans. You can see the Broca's area for speech working together with the motor cortex and the auditory cortex and other aspects all over this place. That's why these conditions are very difficult to handle. They're not like conditions that you can point a particular area and say, this is where the problem is. Okay? And that's why you see that a lot of health practitioners do not know much about how to handle this condition. Especially in foreign countries I don't want to mention. They just tell the parents, you just pay $350 or $300 to $400 per hour, and at the end of the day, the professor will now link you to a speech therapist or one therapist or the other, and you just wasted about $800 to $1,200, and they give you an appointment for next 3 months. You come again, just keep spending money, and the child is getting older. Whoa, so sad. So you can see these are other aspects that are very important, in regards to the how children, how the brain functions with regards to intellectual function. Now, let's look at ADHD as a case study. Above shows the part of the brain responsible for attention, impulse control, and executive function. Just see how God organized these things. So any problem in any of these areas, if these nerves do not connect or interact the way they're supposed to, if they don't develop the way they're supposed to, then that particular part of the brain that controls that attribute in that child becomes affected. That is what this diagram is talking about. I don't want to go deeper into the scientific aspects. Of course, you can see this is a more detailed explanation on how different parts of the brain helps these children to carry out different tasks and functions. Okay, look at the prefrontal cortex. That's what it does. Attention control, of course, impulse inhibition, decision making, and so on and so forth. You can see the anterior cingulate cortex. You can see what it does there. Error detection. You can see emotional regulation. Sustained attention and motivation. That means these parts have to be very, 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 very or do I say these parts have to function appropriately for children or people to, or for children or people to have, what they need to be termed as normal. And the cerebellum is not left out, the parental cortex is not left out. Now, what's the advantage or the importance of natural pharmaceuticals in the management of attention deficit hyperactivity disorder? The first thing is that they are non-toxic. They don't have any side effects. And of course, they help with essential fatty acids, boost immunity, calms hyperactivity down. Wonderful. I'll show us some of those biomolecules that calm these children down. Promotes communication, then provide natural neurotransmitters for improved brain function and mood, mitigates or reduce gastrointestinal issues. Remember, we have the gut-brain axis. And when the gut is inflamed, you know what happens? It's also, it's called leaky gut. That means unwanted materials can easily pass through the intestine and go into the blood and go where? Brain, and begin to cause all forms of issues that we don't want to talk about now. Then, of course, they help to relax the brain against insomnia, improve nerve function in the brain and body, and of course, general regeneration and rejuvenation of the body. It's not left out. Okay. Now, these are just a few examples. Bear in mind that we are not saying that you must buy these products, you must use this product. I would like us to focus on the active ingredients and on what they do. If you can get those active ingredients anywhere, or you can get these things that I'm going to be talking about anywhere, go ahead and enjoy yourself. But from experience, this is what I've been giving to special children, and I've been getting amazing results. Now, for instance, this first one here is kids. It has a combination of biomolecules that help to promote speech. This is amazing, and it's chewable. This contains high dose of high quality eicosapentaenoic acid and docosahexaenoic acid. Those are essential fatty acids. Of course, you know that they are very, very crucial with calming the brain down and brain function. Apart from anti-inflammatory aspects, remember that we talk about leaky gut or inflammation in the gut and all that, they also help with that. Then we can see royal jelly, choline. Remember that we talked about neurotransmitters in the brain. And of course, this also triggers the parasympathetic or the calming axis of the central nervous system, okay? And that helps to also calm the child, apart from providing a precursor for what is called acetylcholine, which is very essential in the brain as a neurotransmitter. That is found in the synapses of the nerves in the brain. This contains cobalamin and folate analogs that are very crucial for nerve function, regeneration, and rejuvenation. Then we have probiotic, contains about 8 billion colony-forming units with amazing microbes, probiotic microbes like lactobacillus species and bifidobacterial species. This will help us to improve gut health of the child against leaky gut. This contains prebiotics, that's soluble fiber. Of course, we know what that does. Then we have chamomile found in this blossom tea. Of course, chamomile helps to calm the child down. Remember that we don't give milk to children that have autism. And remember that autism coexists oftentimes with this condition. So I'm going to show us something that we're going to be giving as a substitute for milk that we can combine with this tea. And while the other children are having their tea, then the special child will have his own tea as well. This is calcium. Bear in mind that these children don't go under the sun oftentimes. And that could affect calcium binding. But that aside, because we have stopped milk, and that means we have cut off a very solid supply of calcium, natural supply of calcium. So we have to also substitute. But I'll show some other one that is better than this. This is a somatic stem cell stimulant. Bear in mind that you have somatic stem cells all over the body, ready to differentiate into the needed cells in the different parts of the body, even in the brain. Vitamin D is crucial because many of these children are under strict supervision and close monitoring. They're not allowed to even go out oftentimes, so they don't have enough sunlight touching their skin. You know that vitamin D is actually sunshine vitamin because our skin produces vitamin D under sunlight. Of course, and you can see the most we substitute. Remember, we talked about the importance of vitamin D in autism and ASD, which often coexist with ADHD. Then we have this nature meal. It contains calcium and other materials that are very important for development and improvement with regards to these conditions. Coenzyme Q10 is found in cardio health, our grandpas and grandmas that have hypertension and all that, oftentimes we give them a combination of cardio health, active C, that's the eicosapentaenoic acid, because there's isoenic acid that helps to prevent cholesterol aggregation. Then, of course, because Q10 also helps to reduce excessive cholesterol in the system. But there's one unique feature it has, which is it powers the mitochondria. Okay, it helps to improve the powerhouse of the cells, which is the mitochondria. And you can see that these nerves also have mitochondria, thereby improving nerve function and all that. We keep talking about fluoride being poisonous. Those of us that were here in the seminar we had when we were talking about substances that could affect children, especially children that have autism and ADHD. Fluoride is poisonous. I showed us the research work, if you can remember, and that's why we have this non-fluoride toothpaste. It's very, very important that we do not give these children fluoride-containing toothpaste. Close-up will not come and tell you that fluoride is poisonous. Colgate will not tell you that fluoride is poisonous. Maclean's will not tell you that fluoride is poisonous. Pepsodent will not tell you that fluoride is poisonous, because the major reason why those companies are existing is profit maximization. This is a substitute for milk because it doesn't contain casein, of course, and also is nutrient packed. Then we have a substitute for people that like spraying deodorant that contain aluminum salts. Remember that can provoke autism that coexist with ADHD. Then we have an organic soap to avoid exposure of chemicals, and we have organic creams. This is the cream I was talking about that we apply to cuts and bruises. Children that have ADHD are prone to injury, but we do not want to start applying iodine there that can still go into the bloodstream and further irritate the brain. Of course, we have another option here where we spray on children, especially if they engage in fire accidents, because sometimes they run into the kitchen and they're just everywhere, and sometimes accidents happen and all that. This is a variant of that, the milk substitute, so that the child will not be restricted to only one taste and all that. Now, I'm going to leave us with this before we shift into other aspects for tonight. You are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be on the winning side. Your food may be killing you. We cannot overemphasize the strong relationship between what we consume and intellectual disabilities like autism and attention deficit hyperactivity disorder. Refined carbohydrates, refined sugars are a no. The choices we make today, or the choices you make today, determine how healthy you will be tomorrow. A lot of children are having ADHD and ASD today as a result of the choices that their parents made. A woman is pregnant and she's smoking, and the child is demanding for Coke 24/7, and they're giving the child. People are just doing all sorts of things, drinking alcohol carelessly. You know, I can't count how many parents have children that have autism and ADHD that their fathers are heavy smokers. They smoked these challenges into those children, most likely, because many of them were born normal, but because of the aromatic hydrocarbons that come up from these things, you see that they affect these children. So let's make the right choices. And let us remember to consult with a healthcare professional or registered dietitian to determine the best dietary approach for specific needs. Additionally, consider consulting with a health professional before making significant changes to diet and or medication. I want to say thank you so much, guys. Thank you, everybody, for being here. And I'll say good night and God bless. Bye.